welcome back. My next guest is Miss Christy Yon, who is the provider liaison of Bluegrass Care Navigators. Did I get it all right?
Well done.
All right. Now, it used to be Hospice of the Bluegrass. A lot of us know it by that name. You've changed your name, but you still do some hospice care, and it's National Hospice Month. So tell us a little bit about what is hospice.
We do some hospice care for sure. We have been the provider of hospice care in Fayette County for 40 years. And we also provide services in 32 counties around the state. So central, northern, eastern, southeastern. We changed the name primarily because we do have other services. We run the continuum of care. We can help people all the way along that continuum. So because we don't only provide hospice care, it made sense to change the name from Hospice of the Bluegrass so that we could represent all of our care.
But being Hospice Month, and for me personally, I'd like to thank your group for the great care that you give patients, because end of life is just a hard time for everybody, and you guys provide comfort and are a big deal. But tell me some of the stories that you do.
Well, we have so many grateful families and patients who are patients now, and I think it's really appropriate that National Hospice Month occurs in November, because people are so thankful for the support that they get. So it comes with a full interdisciplinary team at your service. So 24-hour-7 number that you can call to get help, to talk through things, to have someone come to the home. So you've got a full team access for your patient and your family.
Can help in medication management, supply management, mobility management, all those kind of things that provide comfort in end of life.
Well, it's comfort for sure, because we provide expert connected care. We are the experts in end of life care. But in addition to that, there are a host of benefits affiliated with hospice care. You access it through private insurance, Medicare, Medicaid. If all else fails, we have very generous donors, and we can provide. But the benefits, I think, are what people sometimes miss, is that medications related to the primary diagnosis, supplies, durable medical equipment, plus the IDT, the interdisciplinary team that's at your service, a social worker to help work through some of those psychosocial issues that you may have, family dysfunction, drug diversion, those kind of things, Medicare, Medicaid forms, all of that. You have a nurse, you have an aide, you have a chaplain on your team, and you have volunteers who can come and do just a variety of things.
Who's a candidate for hospice?
Well, the criteria is that given the natural progression of your disease, you would likely not live past 6 months. Now, do people live past 6 months? Of course. Of course they do. We have patients who live a year and a half with hospice care, because the care that we provide and the services that we have to support that patient often help them live longer.
And that referral need to be made sooner rather than later in the process?
Absolutely, yeah. And you know, I preach at you about that all the time. and a lot of people, because they don't realize, you know, that hospice care is for months. It is for a period of time. It's not just for days or weeks of life. And certainly we want to be on board sooner so that we can provide that full support for the patient primarily and the family.
So how do they access hospice? Is it a doctor? Is it a patient? Is it a family social worker? Can anybody make the referral?
Yes, yes, and yes to all of the above. Your physician can refer, specialists can refer, family members can refer. You can refer yourself to hospice care. Now the referral is made and then a consult is done. And then it does take a physician, 2 physicians, to certify that yes, that prognosis is 6 months or less given the natural progression. But all that can happen within a matter of hours.
Well, I will tell you personal experience with my patients. You guys do a great job. But tell me just real quickly some other things that Bluegrass Care Navigators do. Not just end-of-life hospice care, but you do some other things.
We certainly do. And since it's National Hospice and Palliative Care Month, we might want to talk about the difference between palliative care and hospice care, because a lot of people get confused. Even in the industry, we interchange those words. So palliative care is the management of chronic symptoms related to a serious illness. End of story. Any illness, any diagnosis, any age, anything, chronic symptoms. So it is a specialist. Hospice care, on the other hand, is, given the natural progression of the disease, you likely would not live past 6 months. So it is an end-of-life situation. Can palliative care follow you into end of life? Yes. But, you know, the stats show that only about 40% of palliative patients actually then progress to hospice care. So keep in mind that you can manage chronic symptoms and get relief from that and still see your doctor, still be accessing aggressive treatments, all of that.
Great, thank you.
Yeah.